Thank you. Thank you very much. So I will be talking about infrasystems for fragmented cities.
I will be talking about infrasystems for fragmented cities, and
it is. I apologize if there is repeating information here or repeating ideas, but I do not speak Spanish, so I may have missed quite a lot of what was discussed before. So what we're looking at the moment is that cities around the world are increasingly fragmented. They are marked by the coexistence of the urban enclaves of the middle and upper classes and of slums and favelas and urban villages, so urban poor. And everyday life for the residents of such areas is often very radically different. For instance, those living in formal and well-managed areas have safe access to different kinds of infrastructure, such as water, sanitation, and communication. Provision and access are significantly more fragile for the residents of informal and impoverished settlements, and sometimes their access to any kind of infrastructure is makeshift and exploitative and unsafe. Next slide, please. What is becoming
abundantly clear is that infrastructure and its systems are at the heart of any kind of response to the coronavirus outbreak. So the pandemic puts to the test already stretched infrastructural systems. It adds what we would call acute shock to existent latent stresses. And just how resilient formal and informal infrasystems are will have impact on the outcome of a response to the epidemic. And where water and electricity, for instance, are already scarce, this will only be exacerbated by a crisis such as that caused by the epidemic, where the safe disposal of human waste is not guaranteed. We can expect the contamination of drinking water and increased aerosol transmission, where basic hygiene is not guaranteed, such as access to water for hand washing. We can expect increased transmission rates. Where fast transportation is not guaranteed, we can expect slower ambulance responses. Where sustained electricity provision is not guaranteed, we can expect issues around the operation of life-sustaining machinery. And finally, where mobile and internet networks or access to public broadcasting services are not guaranteed, we should worry about access to registration, to emergency programs, or appropriate dissemination of public health-related messages. So the country in Latin America with the highest number of reported cases is currently Brazil. Here it is particularly the favelas that struggle to address the emerging COVID-19 challenges, mostly due to limited access to appropriate healthcare as well as water and sanitation infrastructure. So things like hand washing, one of the core components in the struggle against COVID-19, is not an option here, and neither is the recommended social distancing, obviously. Another major recurrent phenomenon, and one that is not very frequently discussed, is that of the co-occurrence of multiple epidemics. In the case of Brazil and also Bolivia, dengue fever, for instance, it was in full rage at the time when COVID-19 arrived. And so this phenomenon brings to the fore certain feedback mechanisms, for instance, where the removal of debris is central to combating dengue. This can no longer be upheld due to coronavirus distancing rules, which in turn leads to an increased risk of dengue infection. And we are not really aware of any contingency plans by the authorities. One of the main challenges for Bolivia, which has one of the highest informal economy rates in the region, is to ensure that people can sustain their livelihoods for the duration of the lockdown. And this is particularly difficult if taking into account that public transportation has been suspended and people are only allowed to go into the public on 1 day per week, dependent on the last digit of the national ID. So to support them, the government has introduced a series of emergency benefits. But whilst these are welcomed by the public, lockdown measures, as well as pre-existing vulnerabilities, make it impossible for many to access this support. And we can think here of a lack of access to the internet, of mobility challenges, and so on. And finally, as in many, many other countries in Latin America and beyond around the world, access to infrastructures like water and sanitation, again, differs from city to city. And to come back to our theme of fragmented cities, there is a sharp gradient within cities themselves. Next slide, please. So around the world, measures do not necessarily address the issue of fragmented urban infrasystems, neither do they acknowledge that recommended practices such as social distancing depend very much on prevailing living conditions, which again differ sharply within cities, particularly under emergency conditions. The well-managed provision of appropriate sanitation, water, transport, energy, communication, and other infrastructure is therefore key to the success of any public health response. Just what we consider appropriate in terms of infrastructure depends on whether or not specific resources are available. For instance, we will not want to build flush toilets where water is scarce. The everyday practices of users, where people have always defecated in the open, for instance, they will have trouble instantly switching to night pods. And what is also important is, of course, local values and beliefs and norms. And there are too many instances to consider in such a short time. But as an example, again, from sanitation, women will not switch to disposable sanitary napkins if their belief system tells them that washing and or burning their cloth napkins is the way forward. So importantly, a city will be less vulnerable to sudden shock if its infrasystems are working together seamlessly. And we therefore need to understand the dynamics of urban infrasystems. That is just where the codependencies of different infrasystems lie and where they overlap and how they may or may not impact each other. Next slide, please. So the gaps that we identify are that evidence-based decision-making is impossible given the disjointed nature of scholarship in the humanities, social sciences, engineering, and the natural sciences. Everyone is working within the silos, but there's no real synergy and no real discussion happening. And we actually can see what kind of complete disaster can emerge from this here in the UK, for instance, but let's focus on the Latin American issues in particular. So a second one is that we must develop frameworks that link technical infrastructure with service provision, with access, and with wider ecosystems. The third one is we need to develop ways in which to move public health considerations back to the core of any kind of urban planning, policy making, and design. We have to include local knowledge and local stakeholders. We need to engage them and involve them in any kind of research and its application from the very onset. And we really must begin to understand how infrasystems co-evolve over time, how they influence and impact upon each other in order to develop any appropriate response to emergencies and uncertainties more generally. Next slide, please. So currently, I work with a series of excellent partners in the UK, in India, in China, in Japan, and in Brazil on two projects that look at human infrastructure interactions within a wider context of sustainability research. And our team brings together a wide range of disciplinary perspectives, ranging from architecture and urban studies all the way to biological mathematics and sustainability science and complexity science. It is an exercise in patience and persistence, but we are beginning to see the benefits of such an inter- and transdisciplinary approach. We work on the border between formal and informal urban areas physically in order to capture different infrasystems, their interdependencies, and their transitions and transition phases. We use the human ecosystem framework to identify what the critical components of different infrastructures are, and this includes social, economic, environmental resources, and social institution cycles and orders. And this helps us to develop a shared language between what we would usually call the soft and the hard sciences. We work with transition theories in order to conceptualize infrastructural transitions and systems change over time. And this requires mapping the components of infrastructures, the interaction between these components, what kind of emergencies that case study areas that you're working within have experienced in the past, and what kind of responses worked or didn't. So we always try to link with key local stakeholders in order to gather this knowledge. And importantly, we rely on complexity thinking to conceptualize the dynamics, the non-linearity and evolution of coupled infrasystems, which we regard as a type of socio-eco-technical entanglement. We work with causality analysis and agent-based modeling and simulation, and this approach offers the chance of a close-to-reality description of a system, as well as capturing any higher level patterns and emergent phenomena that may be resulting from the interaction of multiple individual entities. And this helps us to imagine what kind of futures we and our stakeholders would find desirable and what kind of effect possible interventions may have. So where we see an opportunity here is to really apply our framework, work with stakeholders, and really try and understand what such an emergent situation as this one, what we can learn from this particular pandemic with our specific approach, in order to apply that for future scenarios, whether that is going to be a pandemic or whether that is going to be some sort of other emergent shock applied to our existing systems, in order to understand how we can react better and more appropriately in situations such as this. Thank you very much.